Hi, so now we're going to talk about anticholinergics, which might be a little bit of a repeat of the Parkinson's disease video, but we still need to talk about these. The prototype for centrally acting anticholinergic drugs is Benztropine, and its mechanism of action is it inhibits the actions of acetylcholine in the brain, and it decreases or actually eliminates the effects of the parasympathetic nervous system. And if we remember correctly, the parasympathetic nervous system is kind of a stay calm system. And this wonderful drug could be yours if you have idiopathic Parkinsonism, um, either if you have minimal symptoms or you're intolerant of levodopa, or you have acute dystonia. That's another reason you would take this drug. Adverse effects are CNS side effects, the normal ones that we talked about so many times, but added on are heaviness of the limbs. And normally people wouldn't think that as a CNS symptom, but it is in this case of Benztropine. And the peripheral anticholinergic effects for it are tachycardia, because remember, a lot of these have to do with depressing the parasympathetic system. So tachycardia, palpitation, hypotension, blurred vision, dry mouth, right? Because you're decreasing the secretions, urinary retention because you're not, smooth. You're a smooth muscle, and decreased sweating and elevated temperature. Okay, so the administration of it is to eat it with food that decreases your upset stomach, or before meals in the presence of a dry mouth. And just remember that ice chips and lozenges are recommended in patients with dry mouth. And you have to make sure that the patient pees before giving them this medicine, because remember, it causes urinary retention. So if you are giving Benztropine, I'm going to say the medicine again, you need to tell the patient to pee before giving them this medicine or before they give it to themselves. They need to pee. Okay. So contraindications, glaucoma because of increased ocular pressure, myasthenia gravis, which is because there's a blockade of the acetylcholine receptor sites at neuromuscular synapses. So it makes the muscles worse, so we don't want to do that. You shouldn't use it in GI or bladder obstruction. Prostatic hypertrophy because they're already retaining urine, and that's not helpful if you're retaining more urine. And then elderly patients who are no longer with it, if you could say in quotes, with it. And then older people than 60 develop increased sensitivity to anticholinergic drugs. And it's also contraindicated in a hiatal hernia. So now we're going to talk about other anticholinergic drugs that we kind of need to know. We don't need to know as much about them as we do about Benztropine, but we still need to know them. So first, the Atropine. We already talked about this in previous videos, but it's the restoration of cardiac rate and arterial pressure during anesthesia. And remember that it's the antidote for an overdose of parasympathomimetic drugs like physostigmine. And also, most people don't know this, but it can be used as an antidote for mushroom poisoning. And I don't mean the drug, I mean the actual vegetable. And then there's Dicyclomine, which is also called Bentyl, and it's GI anticholinergic for irritable bowel syndrome. So it's a smooth muscle relaxant, and that helps decrease the diarrhea that is happening. And just to let you know, it interacts with digoxin and atenolol to cause a decreased heart rate. So you have to be careful of that when using this drug with one of those other drugs. And then lastly, the last anticholinergic drug that you need to know is Oxybutynin, and it's a urinary antispasmodic. It's the drug of choice for an overactive bladder. So it's not as potent as atropine, and it's also used to control bladder capacity in paraplegia and neurogenic bladder. And if it's used in kids under 6, it's usually used to treat the detrusor muscle with neurogenic conditions like spina bifida. And it can be used orally and transdermally. So as we always need to talk about is toxicity. And the symptoms for toxicity of anticholinergic drugs, if we think about it, make a lot of sense. So hyperthermia, okay, so your body temperature is getting a lot higher. Dilation of pupil, okay, so whoop, right? Paralytic ileus, meaning the complete opposite of diarrhea, basically. Delirium, tachycardia, urinary retention, seizures, coma, and respiratory arrest. So what would we do if there's an overdose in an anticholinergic drug? So we would use activated charcoal, or we would use the physostigmine salicylate, and we push that slowly through the IV. We also could use diazepam if they're exhibiting excitatory CNS symptoms. And you can use ice bags for cooling down in the case of hyperthermia. So I just like to remind you the mechanism of action of Benztropine, specifically, because that's pretty important. It inhibits the actions of acetylcholine in the brain, okay? So in the brain, acetylcholine, it inhibits those reactions, and it decreases or eliminates the effects of the parasympathetic nervous system. So your parasympathetic nervous system, if it's decreasing or eliminating the effects, you're going to be on edge on, everything like that. So that is what you want to think about when you think about anticholinergic. I hope that helped. If you have any questions, please email me. Have a great day.